Hi guys, this is Jeanine from the Vision Division. Welcome back to my channel. This video isn't going to be glamorous or teach you anything other than life, what could happen. So this is story time with Jeanine. In December, I made a video letting you guys know that I'm alright and letting you know it took me so long to do another video. I went through kidney stones from hell. That's what they are. Kidney stones from hell. Okay? And I wind up in the hospital. But I'm going to tell you the story because just something simple as kidney stones turned out to be basically a 2-week stay in the hospital. And the reason why is why I'm doing this video today, to tell you the story of what happened. The pain started December 4th. When the pain started on December 4th, it was really just in the back area. And it lasted off and on until December 7th. December 7th at 2:30 in the morning, I was awakened by severe pain in my lower back. Let me show you. It was in my lower back here. It was at the top of my stomach here. And it was under my belly, the groin area right here. Okay? But it was on this side. It was on the right side. So the pain was here, right here on the top of my stomach. And it was back here. You can see it right back there. The top part was a dull, aching pain. The abdominal pain was like cramping. And the back was a burning pain. I couldn't sit down. I couldn't lay down. I couldn't walk. I couldn't do anything. I took meds. I took a shower. I used a heating pad, and I did all of that and had no relief. So I wind up going to the hospital, going to Lincoln Hospital, which is right down the block from my house, so I can walk there. So that's when they told me I had kidney stones. That a kidney stone was actually in the, what is it called? I think it's the urethra, no, not urethra. In the tube between my bladder and my kidneys. And it was blocking the urine from coming out of my kidneys to my bladder. So my right kidney was swelling up because urine was backing up because it couldn't get through. When they told me I had kidney stones, they went on and admitted me. I stayed in the emergency room for almost 24 hours. And they only gave me 2 sandwiches within those 24 hours. And then I was told that when I get to my bed, that I'll be able to get something to eat. I got there like maybe 7 in the morning. So 7 to 6, about 6 o'clock, I got a bed. And then they told me that when breakfast comes, I'll be able to eat breakfast and I'll be able to eat. So, but breakfast came and went and nobody gave me a plate. I spoke with the lady that brings the breakfast, and she was like, yeah, okay, I'm going to get you some breakfast, right? She never came back. Called the nurse in. I'm like, I'm really hungry. Can I have something to eat? They said they're working on it. They're waiting for for the doctors to come in and say something about whether I can eat or not. And I'm like, why can't I eat? They told me I can eat. In the emergency room, the doctors did. Lunch came, and I spoke with the lady that delivers the food. I told her my name and everything, and she said, no, you're an NPO. Nothing per oral, right? I said, no, I'm not. And she was like, yeah, you are. So I called the nurse again, and I said, can I please speak with my doctors, because they're saying I'm NPO, but they told me I can eat. Okay? So The nurse said, well, the doctor said that you're NPO because you're going to have surgery today. I'm like, surgery? Nobody told me anything about any surgery. And then they said, no, you're supposed to have surgery today. So I said, I need to speak with my doctors. And now this is, like I said, this is after lunch, where lunchtime I didn't get to eat anything either. And I'm starving here. They finally took me off of NPO without the doctors coming in, because they said that for some reason your surgery was canceled. They told me that since I didn't eat anything, they were going to get me something to eat. So midnight that night, I don't eat anything after midnight. I said, that's fine, you know, because they're going to do the surgery the next day. I said, that's fine, just, you know, please give me something to eat. So the next morning, finally my doctors came in and they told me what was going on. They told me that how they were going to do the surgery. The surgery, what they were going to do was put a stent in, and they were going to laser the thing, the kidney stone out and everything. They got me ready, but my IV started malfunctioning. So they had to put a new line in before they could take me to surgery. And being that my veins are stubborn, it was very difficult for them to find another place to do it. All the nurses had trouble getting the IV in. There is only one vein that you could get the IV in on the first try, and that's the one that was malfunctioning. So the doctor came in, and he kept insisting to put it on my hand. There is a vein here. There was a vein somewhere along right here, right? But I kept telling the doctor that's a bad place to put it because that hurts very bad. That's gonna hurt me extremely bad. I've had IVs there before. He was like, no, 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 we can do it, we can do it, you're fine, you have to do this, you have to have surgery, okay? He put the IV in there, and it kept burning, and I kept telling them, it burns, it hurts. Before I was able to get the surgery, this vein was blown. I should have pictures to show you that this vein was blown, which means that this vein was black. And they had to take the IV out because it was no longer functioning. The vein wasn't letting it happen at all. So they had to take this out and put one in another place. They wound up putting it here in my arm again. So this arm right here is good. This right here is good. Any place here is no good. This one is very stubborn. This one you can get at any point in time, my left one. Also, they had to give me a COVID test. They had to give me a rapid COVID test. And they did, and it came back negative, but we had to wait for that also. So at 2:06 that afternoon, now remember, again, I didn't eat anything from midnight that night. So 2:06 in the afternoon, the next day, is when they finally took me up to get surgery. Basically, what they did was they put a stent in. They were going to laser the kidney stone out. When they got in there, they put the stent in and they realized that the stone was too big. And if they tried to take it out, they would have burnt my sides, my walls, the sides of the tube, and burnt the tube and damaged it. So they put the stent in, and the stent is to help open the tube so that they can get to the kidney stone. The stent is to also drain the kidney, the urine that's backed up in the kidney, to drain that and keep it flowing. The surgery was December 10th. They sent me home December 11th. I had a urology appointment on December 14th where I had to go to schedule the next surgery. Okay, so that was on the 14th. The surgery was set for the 21st, which was 7 days from the 14th. So it was a week after the 14th. Anyway, so I got home from my appointment and my back was hurting on the right side where the kidney stone was. And it was hurting really bad. And I didn't feel well at all. Later that evening, I noticed that I had a temperature. So I took my temperature and, you know, it was over 100. It wasn't much over 100, but it was. And I knew that I could tell that I had a fever. And I wasn't feeling well. So, you know, I stayed in bed. I put covers on me, but, you know, I had my feet out, so I had the fan on. My son, he's telling me keep the blanket off. That will cool me down. So I did that. Long story short, I woke up the next morning and I had 104 fever. 104 fever. 104 fever. So I had my boys call the ambulance, because at this point I was lethargic. I think that's the word. I was lethargic and I couldn't walk. I couldn't do anything. And my temperature was very high. When I got to the hospital, it was diagnosed. It was decided that I had an infection from the kidney stone that they could not take out. So they admitted me back to the hospital, okay? Now, I'm going to try to go through the rest of this as quickly as I can, because I know I'm using up a lot of time here. So, it was about another 24 hours before they sent me up to the bed. No problem with that. That seems to be the standard. When I got back up to the bed, the nurse, instead of, now remember, I have a high fever, and they haven't given me any antibiotics or anything. Instead of starting me on the antibiotics, I was told I have to take an ice bath. I have to take an ice bath, okay? I'm like, are you kidding me? Why don't you just start the antibiotics and give me an ice bath so that you can start getting my fever down? Because I've had this fever for over 24 hours, which is not good, okay? She said, no, the orders are to give you an ice bath, see if that brings your temperature down. If it doesn't bring your temperature down, then we'll give you antibiotics. So I literally, not feeling well and everything, she bought ice, she bought a bucket of ice, and I had to take the washcloth, and I had to put the washcloth in the ice. She also had me eat ice non-stop while I'm doing the ice bath. Now I'm shivering, but my fever's not going down. So I have to take that washcloth. I told her, I'm gonna do it. You're not doing it. I'm gonna do it. So I put the washcloth in the ice, got the washcloth cold, and I had to wipe all over in my face. I had to wipe all over my body, and I had to, I had to keep dipping it in there as soon as it gets hot because I have a fever. So of course, it's making the rag hot right away. Had to keep on putting it all over my body. After I did that twice, I told her my fever, checked my fever, it wasn't going down. Then they gave me antibiotics. I was like, oh my God, you guys are killing me here. Finally, they started giving me antibiotics. There was a bad storm, a bad snowstorm. Remember, this is December 2020. There was a bad snowstorm. So most of the nurses didn't come in. So my nurse, whoever was on my floor, whoever my nurse was supposed to be, did not show up. So another nurse came in, and she was late because she was a traveling nurse, which means that when nurses don't come in to work, and it's one of those things that there's a nurse that goes from hospital to hospital wherever she is needed. So this nurse came in late, and granted, she didn't go around with everybody and meet all the patients, get the story of who this patient is, what this patient's name is, what that patient's name is. She wasn't there for any of that. So that part I understand. But let me tell you what she did. I was asleep about 11 o'clock. She came in about 10. I was asleep, well, partly, almost asleep, about 11 o'clock. And she came in to do her rounds of doing her medication, passing out medication. Now, if you know, they put a wristband on you with like a barcode, so that they have a scanner and they can scan your barcode, especially if the person cannot speak or the person is asleep. So you can scan it and see what the patient's name is and see if the medication that you're giving them is the right medication. This nurse did not do that. This nurse put medication on my IV and she went to change that. So she put the medication on the IV, and there's the regular saline drip that goes. She took that saline drip and was going to replace it. While she was doing that, she stood behind me. Now, mind you, I'm laying away from the door. I'm laying away from her, and she's standing behind me, yelling somebody's name, and it's waking me up because, and I was half asleep, but I can hear her moving around and stuff. And she's standing behind me, and she's yelling somebody else's name. I turned around to her, I was like, who are you talking to? Because she was like, medication, medication. And I'm like, I turned around, I said, who are you talking to? I said, because that's not my name. Why are you standing behind me? That's not my name. She said, what is your name? I told her what my name was, and she quickly went from over here, ran all the way to the other side of the bed, and took that medication off of my bag. She put my neighbor's medication, IV bag medication, on my IV. And the only reason why it wasn't going through my veins is because she had to change the saline. And I sat there and I talked to her. I was like, did you give me the wrong medication? She was like, yes, I thought that you was the lady. I thought that you was the lady over there. And I was like, I have a wristband. You're supposed to scan my wristband. Why didn't you scan my wristband? You could have killed me. She said, I'm sorry, I'm sorry, I'm sorry. Okay. Of course, you know, I did not sleep that whole night. First thing in the morning, I called the administrative nurses, the higher ups, the nurse supervisor, the floor manager. I called everybody I could possibly call. I told them what happened. I told them what her name was. And I told them never let that woman near me again, which they did. She did not come near me again. So the medication that the nurse was supposed to be putting on my IV bag was my antibiotics to bring my fever down, okay? The antibiotics was a strong antibiotic. Somewhere along this line, I will put the name in because at this moment, I cannot remember the name of that antibiotic, but I know it is a strong antibiotic. They say whatever infection I have, this antibiotic will knock it out, okay? The problem is, I started developing a rash. I told the nurses, it started where the IV was, which was right here. So all around this area right here, you can see all along this area right here, it started getting puffy. I will insert the pictures. It started getting puffy, and my arms, I noticed, was getting red. Now, I had a mask on, right? So you see where the mask hits back here and back here, right? So it started itching, and I kept scratching, and I kept going like, oh, I gotta take this mask off because it's itching. But I didn't realize that this was itching until I started really scratching all over, and then noticing I have a rash growing everywhere on my body. The only place I didn't have a rash was right here. So I had a rash on here, I had a rash here, I started having a rash on my stomach. I'm telling the doctors, and they say, oh, I'm telling the doctors and the nurse, and they're saying, oh, well, we're going to change, maybe you're allergic to the latex. I'm like, no, it's all over my body. Eventually, I think it was 24 hours after I started itching, and I was itching all over my body, everywhere. And eventually, it started coming down over my face like this, the rash. Finally, somebody paid attention to me when it was all over my body. The nurses literally had to come and put calamine lotion. I had to be completely naked. They had to put calamine lotion all over everything. I was allergic to the antibiotics. Yes, that's why I'm putting the name in here somewhere. I was allergic to the antibiotics, so they had to quickly stop the antibiotics. And just stopping it doesn't stop the itching. So, okay, they gave me Benadryl. Okay, they gave me a shot of Benadryl. That barely worked. But, you know, like maybe 3-4 hours later, I'm telling them I'm still itching. I'm still itching like crazy. Like, oh, goodness, crazy. They gave me Benadryl in my mouth and another shot of Benadryl. Guess what? They gave me too much Benadryl. My blood pressure dropped. And I had to go to the bathroom. And I'm screaming at them, I don't feel well. Help me. I have to go to the bathroom. I went to the bathroom, and because I called for help, they came, but I was on the floor. Because my blood pressure dropped, and I was about to pass out from all that Benadryl. What I just told you is related, similar to the reason why I have this mask on. Which I know you guys are going to want to know why I have this mask on. I'm going to let you know right now. Not this story time, but the next story time, I will explain why I have this mask on throughout this video and the next video. Okay? So I need you to stay tuned for that, because I will be telling you another story, and it will explain why I have this mask on. Now, back to the story. The rash not only was going like this on my face, like I said, it was already on my whole body, but it was also on my tongue, which I did not know. Everything started tasting like it had hot sauce on it. And I didn't realize that it was doing that. I did not realize that it was from the rash. And I kept saying, oh, they put so much seasoning on this food. It's like hot, 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 so I couldn't eat anything. When I tell you I was completely miserable, I was completely miserable. So, now, I told you that my surgery was supposed to be on the 21st of December. They kept me the whole time. When December 21st came, they did not give me the surgery. They gave it to me December 22nd. I stayed in the hospital the whole time because they wanted to make sure that my fever didn't come back, that the infection didn't come back, that I didn't pass out anymore. Finally, I got the surgery on the 22nd. They were finally able to break up the kidney stone, put a new stent in, and finally send me home the next day, which I went home on the 23rd. The stent that they put in, the new stent that they put in, had a string that was coming out, which they taped, and excuse me for the graphic, what I'm about to say, they taped the string to my pubic hairs. Now, when I tell you that is so uncomfortable, just sitting down, okay, just sitting down, it pulls. Any movement you make, it pulls, and you feel the string pulling the whole thing inside your bladder and your uterus and your kidneys. You feel, not the uterus, the utera, I think that's what it's called, utera, I'm not sure. But you feel the whole thing pulling. And I had to wear that for a week at home. I had to walk slowly. When you use the bathroom, you can't just wipe yourself. You can't just wipe yourself. You literally have to pat. You have to pat all around. So make sure that if you ever have this, you know to pat all around, because you can't just wipe. You can pull it out. Okay, so I'm headed back to Lincoln Hospital. Hopefully, this is the last step to this whole ordeal with the kidney stones. Today, I'm supposed to be getting the last stent taken out. And I don't know, we'll see. I'm on my way though. I can't really start fully healing until they take this foreign object out of me. So, stay with me. So this is the room that they're going to take the stent out. So it is done, and it did not hurt at all. Like the doctor said, the worst part would be taking the tape off, and that's what was the worst part. It did not hurt at all, surprisingly, and I'm happy. So that part's over. They finally took the stent out, and I don't have to get any more stents. I don't have to have any more surgeries unless I get another kidney stone that blocks me and doesn't pass by itself. So what they're going to do now is they're going to do a whole bunch of tests. They're going to send me a kit in the mail so that they can test, see what kind of kidney stones I have, see how they're produced, so that they can give me a clear-cut way of preventing them in the future. So, I mean, the hard part is over. Now it's just I got to test my urine and see why I get these kidney stones and how I can stop it from happening. So I'm happy. It's another thing I made it through with God's help. Yes. Thank you, everybody. Because you cannot understand how difficult this last 2-3 weeks have been. And now it's 3 weeks. 3 weeks from the beginning. Talk to you later. So a week later, I went back to the hospital. I had to go in the little surgery. I had to go to the urology department. They had this. I'm back in the OR to get this out. Go in the OR. Tell me to pull down my pants. They said the worst part is taking the tape off. They took the tape off. They pulled it out. It did not hurt at all. Just taking the tape off the pubic hairs is what hurt. But actually pulling the string out did not hurt. So that was a good thing. And finally, the kidney stone from hell story was over. I have not had another kidney stone since. I did a 24-hour urine test, which means that you pee in a little cup for 24 hours every time you use a bathroom. You pee in this little cup, you put it in this jug, and then when you fill it up, after the 24 hours is up, you send the jug to the hospital. And the hospital will analyze it to see why you have kidney stones, what kind of kidney stones you have, what you can do to prevent it and everything. They said they have no idea why I have them. So finally, I realized that peanut butter caused that kidney stone from hell. At the time, I was eating a lot of peanut butter and jelly sandwiches. You know, and with me eating all those peanut butter and jelly sandwiches, I was eating a big amount of peanuts. And that's what caused my kidney stone from hell. That was December. I have not had another one since. I have not had any more peanut butter. If I have a Reese's peanut butter cup, but that's it. I have that like once a month or something like that, maybe. Or once every 2 months, or once every 6 months. I don't know. But I stay away from peanut butter now. If I'm going to eat it, I'm not going to eat it in abundance like I was doing before. So this is my story for you guys. My kidney stone from hell. I am fine now. Now, I want you to stay tuned for my next video. You don't want to miss that. I had COVID. My next story time is my COVID experience. Thank you for watching, and stay tuned for my next video. If you like this video, please hit the like button, hit the subscribe button if you're new. If you're not new, again, thank you for coming back. And please come back again for the next one. Leave me a comment. Let me know if any of you have ever had any type of experience like this with a hospital. I mean, they took me through hell. They took me through hell. And it all started with the kidney stone from hell. But I'm fine now. Thank you for watching. Bye-bye.